Hi, I'm Dr. Melvin, one of the pediatricians here at Choptank Community Health Systems in Denton, and I'm here to talk about the Pfizer COVID-19 vaccine, which has been approved for use in kids 12 and older. Myth number 2 that I'm going to bust today is that the vaccine process was rushed, and so it's not safe for my child. I want to reassure you that although it happened quickly, it was done safely. The mRNA technology that was used in this vaccine has actually been in development for decades and has been studied carefully and was ready to be used for the COVID vaccine. Clinical trials happened with more than 10,000 people before the FDA granted approval, the emergency use for the vaccine to be used. And it was found to be both safe and effective in the studies. And now more than 287 million doses of the vaccine have been given in the US alone, and we have seen that it has been safe and effective, as you have seen with mask guidelines going away and places opening back up, which is exciting. So they did a clinical trial in younger patients or children 12 and older and found that to be safe and effective for them too, which is why they decided to grant the approval for use in these kids. There are actually studies ongoing with children as young as 6 months old, so we should be seeing in the future hopefully approval for even younger kids to be getting vaccinated to protect them against the coronavirus. The vaccine, we know that it's effective. We know that it prevents serious illness, hospitalization, and death. And so I'm excited that my patients 12 and older are now eligible to get the vaccine, and that I really do feel like it's safe. And actually, it's probably been more closely looked at than any other vaccine in history because it has happened so quickly. If you have any other questions, feel free to comment below and check back for more myths that we'll talk about.